Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have discussed Kas Vyadhi in detail and new manifestations like allergic Kas, why Pitta Kas is rare, etc. in detail. Hope you have understand and liked it. Before starting today's lecture, I want to emphasize one important thing that when we are discussing any Vyadhi, I am not going by book like Hetu, Nidan, Pururu, Puru, Samprapti, Upashay, Anushay, etc. Because all these things you must have learned during the academic years, or even today you can go to the books and you can go through all of them. My aim will be read the between the lines which are not explained in the text, or discuss those things like allergic cause we have discussed, that in which are we have to face in our clinical practice, and how we will deal with on the principles of Ayurveda. So when we are going to learn discuss the diseases, Vyadhis, I will be focusing on these factors than going book by book. So after Kas, we will move towards the Shwasa. By Shwas it means there is Shwas Vruddhi, increase in the number of breaths without any exertion. So it is not Shwas Vyadhi when someone runs or climbs and gets Shwas, because though it is the Shwas Vruddhi in these conditions, the Shwasa Gati becomes normal after taking a rest. But when there is Shwasa Vruddhi without any exertion, we have to nominate that patient as a Shwas. Now, Samprapti of Shwas is very important, because a lot of things about the treatment are dependent on this Samprapti. What Samprapti tells? Kapha Uddhagamana Pavana Vishwagasita. Kapha Uddhagamana. Kapha dosh obstructs the gati of Sancharitva of Vayu. Kapha dosh obstructs the gati of or Sancharitva of Vata dosh. Dushti of Pran Udaka Vahini Sotamsi. Pranodakana Vahini Dushtas Sotashi Doshayan Urasta Kurute Shwasam. Where this happens, Samprapti happens, Urastha means in Prana Sotas, in the lungs. So first is Avrod by Kaphadosh, then obstruction to the Gati of Vayu because of this Kaphadosh. Where it happens in the Ura Pradesh, in the lungs. Urastha Kurute Shwasam Amashaya Sabudbhavam. It's a very important phenomenon which is described only by Ayurveda and not any other science. Urastha Kurute Shwasam Amashaya Sabudbhavam. The origin is in the Amashaya. So which club cuff is there? There is Kledak cuff in the Amashaya, which goes to the lungs, obstructs the lungs or Sancharitva of Vayu, and Shwas is created in the body. In the Samprapti, how does Samprapti happen? There is a famous slok. Sanchayancha Prakopancha Prasaram Sthana Samshayam Vyakti Vidancha Yo Vyakti. Sanchaya, Prakop, Prasar, Sthana Samshaya, Vyakti and Ved are the 6 steps of the Samprapti of any disease. And in my opinion, Shwasa Vyadhi is the classic example to explain this shlok. Now let us see step by step. What they have said, Urastha Kurute Shwasam Amashaya Sabudbhavam. Okay. So what is the factor regarding those present in the Amashaya? Is a Kledak curve. Kledak curve in the Amashaya starts accumulating. Now this accumulation in the Amashaya is called as Sanchaya. This accumulation in the Amashaya is the Sanchaya Avastha. After some period, the Kledak curve occupies the Amashaya in full. After some time, the Kledak curve in the Amashaya occupies the Amashaya in full. So it is the Prakop. Up to this condition, the Kledak curve is still in its own Ashaya. That is Amashaya. So Sanchaya and Prakopavastha happen in the own ashay of the dosh. Now amashay is full, but accumulation of the curve is going on, and now amashay is not sufficient to accumulate this further increasing the curve. So what is the next step to be happen? This the curve after filling the amashay travels to the other part of the body, and which is this other part is the urasthan or pranasodas or the lungs. So sanchay in the amashay starts accumulation in the amashay. First step, prakop. Amashay is full back to the curve. This is the second step. The amashay is not capable to retain the further to the curve, it is going to accumulating. So to the further to the curve, there is the only way to go outside the amashay in the other ashay or in the srotas. It is called as, so it travels to the lungs and gets accumulated in the lungs in the other sthan. It is sthana samshraya. It is the sthana samshraya. Now let us see by this that in the amashay there is started accumulation. It is called as sanchaya avastha. Amashay is full back like the curve, so it is prakopa avastha. After fulfillment of amashay, the curve travels to the lungs, urasthan, and gets stagnated in the lung field. It is the sanchay, prakop. This traveling is prasara, and this accumulation in the lung field is the sthana samshraya. Hope you understand. So sanchay, prakop, prasara, sthana samshraya. What is the next step? Vyakti. Vyakti means lakshana starts seeing the patient. Vyakta. Lakshana is vyakta on the patients. Now what happening when the lungs are normal, lung fields are clear. Say for example, in one breath, when lung fields are clear, a person is getting 100 units of oxygen and its capacity of or requirement of oxygen is fulfilled. In that case, when lung fields are clear. Now, in this case, lung fields or portion of the lung fields is occupied by now the curve, and that's why sancharitva of vayu is already obstructed. Lung field which is available for the breathing is now restricted, and only this portion is available. I am just giving the example. Okay, whole lung field is, when there is lung field is clear, the whole lung is clear. A person is getting 100 units of oxygen and it is sufficient for its normality. And now because of this stagnated accumulated the curve, only some portion is of lung is available. So what will happen? In spite of 100 units of oxygen, the person is getting only now say 60 units of oxygen because lung fields are not available. In one breath, patient requirement is 100 units of oxygen, and now the patient is getting only say 60 units of oxygen, and there is deficit of 40 units per shwas. There is deficit of oxygen per shwas is 40 units. Requirement is 100 units. So what will be the reaction of the body to compensate the deficit of 40 units in each shwas? The body will start taking more breaths. The body will start taking more breaths, so the 40 units of oxygen which is deficit will be in the each shwas can be obtained, and the requirement of 100 units will be taken care of. So sanchay, prakop, prasara, sthana samshraya, and after sthana samshraya, because of these lung fields are not available, patient starts more breathing, breathlessness what we called it as, and this is a vyakti of lakshana. Shwas lakshana starts seeing in the body of vyaktikarana of shwas lakshana starts in the patient. And what is the next step? Bheda. Bheda means classification. For example, in Kas we have seen Vata Jakas, Pitta Jakas, Kapha Jakas, like that. So Further classification will be Bheda, what is Vata dominant or Kapha dominant or it is Shudra Shwas, Tamaka Shwas, etc. But this Samprapti is a classic example of Sanchay Prakop Prasar, Sthana Samshay, Vyakti and Bhed, which is the slope of the how Samprapti happens in the body. Hope you understand this Samprapti. I have taken it in details because on this Samprapti treatment is totally dependent, and we will discuss this Shwas Vyadi in the next episode. Thank you very much.